my name is Avery Myers. I am a fourth semester nursing student. Today is September 22nd, 2018, and I will be demonstrating how to put in an NG tube. So before I even enter the room, I would make sure the doctor had an order to put an NG tube in. I would also check the patient's history of mental status, nasal patency, any deviated septum, or any surgeries on the nose. So once I've done that, I will enter the room. I'm going to introduce myself to the patient, check their two patient identifiers, and let them know if there's any way they can help me throughout the procedure. I'm then going to assist my patient to a high Fowler's position, and I will put a cloth over their chest. I'm then going to perform hand hygiene, provide privacy. I will then take out my tubing. I'm going to measure the tube from the tip of the nose to the earlobe and then down to the xiphoid process. That measures at the 50 mark, but I'm also going to put a piece of tape around it just so I know. I'm also going to prepare my tape for when I put the NG tube in and have to secure it. So I'm putting the tape around the tube, and then I'm going to make some smaller pieces so that I can hold that NG tube in place. And then before I insert the tube, I also want to check the patency of the nasal, because I want to see which nostril would be better to put the tube in. So once all that's done, I'm going to put on just some clean gloves. And I'm going to lubricate the tube the first 4 inches. I'll have a basin here for any GI contents that come out. And then I'm going to have my patient's water ready for them to drink. I'm going to have them hyperextend their neck, and then with the tip pointing down, I'm going to insert it into the nasal tube. Once I hit resistance, I'm going to have them tilt their head forward and take sips of water, and with every sip, I'm going to insert it 2 to 4 inches. I'll then rotate the tubing 180 degrees, and with each sip, keep inserting the tube until I would reach the 50 mark. So once my tube is down to the measured mark, I will temporarily secure the tubing so that I can check the placement of the tubing. I can do this one of 3 ways. I can aspirate the GI contents and check them with a pH strip like this. I can get an X-ray to check placement, and I can also instill 10 to 30 milliliters of air into the abdomen and listen for swooshing with my stethoscope. So once that I have confirmed the placement, I'm going to secure the tubing a little bit better. A couple more pieces of tape. To really make sure that it doesn't come undone when the patient is sleeping or anything like that. So once I have it secured to the nose, I would also take a safety pin or clip and clip it to my patient's gown, loose enough to where they can still turn their head. I would then take the tubing and I would connect it to whether it needed to be on suction or feeding. I would hook it to the appropriate tubing. Then I would make sure my patient is comfortable, tolerated the process well, and then I would document any relevant findings, such as how they tolerated it, any intake or output from the tubing, and that's it.